Dawnette Lewis. I'm a high-risk pregnancy specialist, and I'm the director for maternal fetal medicine at Northwell University Hospital, and I'm also the director for the Center for Maternal Health.
I'm Weinberg. I am the director of the adult congenital heart disease program here at Northwell Health, and I am also the high-risk cardio-obstetrics director at Lenox Hill.
It's a difficult question, and I think the symptoms that someone experiences during pregnancy and what they might experience because of heart disease are very similar. So my recommendation is that anytime the patient feels different or this feels like there's something new, then they should call their doctor because the symptoms are very similar. Dizziness, shortness of breath, all those things, rapid heart rate are common in pregnancy, also common when someone is having a cardiac event. So anytime a patient is concerned, they should err on the side of caution and talk to their physician.
So high blood pressure is very common in women while they're pregnant, especially in the Black population. There's several different types of hypertension during pregnancy. There's chronic hypertension. That's high blood pressure that's diagnosed before you become pregnant or up to 20 weeks of pregnancy. There's gestational hypertension, which is diagnosed after 20 weeks of pregnancy. And then there's preeclampsia. So preeclampsia is defined as high blood pressure after 20 weeks and can occur postpartum as well. And you also have protein in your urine, new headaches, spots in front of your eyes, chest pain, abdominal pain, shortness of breath, or various other symptoms. And if you have those symptoms, it's important to get checked out because the faster we deal with preeclampsia, the better your outcome is and the better your fetus's outcome is.
We consider pregnancy a stress test for the pregnant patient. And so oftentimes, like Dr. Weinberg says, pregnancy, because of all of its cardiovascular changes, it unmasks disease that normally would not have been manifest. And so sometimes pregnancy may be life-saving for the patient because they're diagnosed with something that they otherwise would not have known.
We like to say that pregnancy is like running a marathon. So it's a 9 or actually 10-month marathon that women are running.
So the United States has the highest maternal mortality rate when compared to other well-resourced countries. And the data from the CDC shows us that Black women are disproportionately affected, and Black women are 3 to 4 times more likely to die in childbirth when compared to white women. I think it's the reason why Black women are at a high risk. It's a very complex answer. And so there are many reasons. One is pre-existing medical conditions. The other is access to early and quality prenatal care. And the third is that the effects of structural racism and implicit bias that also impacts the care that Black women get when they enter the healthcare system. So there's many. We've targeted low-dose aspirin and its effect on preventing early onset preterm preeclampsia. We've had a lot of education about the signs and symptoms of preeclampsia. We also have a cardio-obstetrics program with the Department of Cardiology, where patients who are at risk for developing cardiovascular disease are referred to that program through the Cass Institute for Women's Health. We're also paying a lot of attention on this nulliparous term singleton vertex delivery, which is someone who's pregnant for the first time and their rate of having a cesarean delivery, because we know that a cesarean delivery can increase the ICU admissions, there's an increased risk of blood transfusion, there's an increased risk of unplanned hysterectomy with a cesarean delivery. And from our own data, we know that for Black women, their cesarean delivery rate, this NTSV rate, is higher when compared to white women.
Our ultimate goal is to have women live healthy, happy, productive lives and watch their children grow old.